The phlebotomy service at Chelsea and Westminster and West Middlesex hospitals isn't particularly big. We've got 3 to 4 stations at each site that run from 8 till 4:30ish. But because they're not particularly big, we also have quite a small waiting area, and trying to ensure 2-metre social distancing in the waiting area was proving impossible, to the extent that some days between the first and the second wave we had queues down the corridor, which also wasn't particularly good for social distancing, because that's the main corridor through the hospital and through to the outpatient areas. So our main reason was around social distancing and making sure that the flow of patients into the phlebotomy department was constant. So we worked out that we could see the same number of patients each day by putting in an appointment system and only ensuring that 4 people turned up in any 15-minute slot. So we looked at 2 different things. We looked at 10 to 8 and other online options for booking. The reason why we went with 10 to 8 was firstly because of the cost. It was a very affordable solution for what is quite a small phlebotomy department. But the second thing was also the simplicity. So other systems might offer check-in and telephone booking and all of those kinds of things. But going from a service that is purely walk-in with the patients not having any need to do anything to asking them to make a booking before they came in, we wanted to make it actually as simple as possible. 10 to 8 gave us that ability to literally just replace the queue that was going down the corridor with a virtual queue, with the patients being told to turn up no more than 5 minutes before their appointment and collect a ticket when they got there. And that was really important, the lack of change in workflow for phlebotomists and the lack of change in workflow for clinicians. Because phlebotomy is a 5-day-a-week service that is open from 8 till 4, there was no ability to shut the department for clinical governance half days, whole team training on important things like deprivation of liberty or the Mental Health Act, basic life support training, or even just for an hour's team meeting. We always had to exclude a couple of people from the team meeting in order to ensure that we were keeping the department staffed. So for me, there's the kind of practical things around staffing and social distancing. But what I think is going to be valuable in the long term is the ability to ensure the training and the quality and the teamwork by being able to close the department even for just short amounts of time in order to get those team meetings and those quality meetings in.